Let me tell you, establishing culture and building teams is hard work, right? In the military, sometimes you don't really get to choose your team, right? So it's just like, here's the next person, fill in the role. Um, in the hospital side, it's more difficult, right? And if you have difficult work to do, it's imperative that you have a good team. And figuring out how to put that together has been a real challenge over my career. And I think now, right, I joke with my manager who's under me that it's taken me 8 years to get the team where I wanted them to be, right? Because it's hard work. Doesn't mean we didn't have wins along the way, but I think in terms of my strategy, it's first and foremost make sure that everybody is on the same playing field when it comes to education, knowledge of the job, right? You want everybody to be offered the same resources and be at the same place. That way, we can have those team conversations and nobody's left wondering, well, what does he mean by that? Or what does she mean by that? We have a equal number of people who have been educated, they've been standardized, and now we can have those conversations that move the needle. I think second is as a leader, I won't ask you to do anything that I'm not willing or capable of doing myself, right? Now, I came up through infection prevention, having to learn, the nitty gritty of the different, electronic health systems, the different infection control surveillance systems. But as a leader, I like to know that what I'm asking my team to do, I can also stand in and do myself. Now, as my team has grown, things have become more complex. I can't do their individual day-to-day jobs all the time, but I can say, what do you need? What can I do to help support you to do this better, faster, quicker, whatever? And I think being that sort of, the cliche of being a servant leader, really for infection prevention, I think is important because you want to make sure that with the ever increasing pressure to do better from a reportable data standpoint, is my team getting the things they need to do the job we're asking them to do? And if that answer is yes, then I think I'm doing a great job because then the numbers and the indicators start to follow. So I think for me, it's picking the right personalities to succeed on the team. Picking a good multidisciplinary team, I think, has been important, and then supporting them with whatever they need: education, stuff, equipment, time, and flexibility. I think has been a real key, to building our team here. Especially as you can look around you, and something like 60% of households have at least a bachelor's degree, and somebody works from home, right? In the hospitals, we traditionally have not been a work from home culture, but adding that flexibility in for infection prevention teams, I think, is a big job satisfier. So trying to meet the generations where they are and what they think they need and what we need, I think is gonna be a win for everyone.